welcome to Ajaikumar. You came back to India from the West. You set up a cancer hospital, and apart from what you did for cancer, you really felt for this space in oncology and what causes cancer. So you started fighting to create alternative revenue streams for tobacco farmers and now healthcare investment. So it's been a journey, and I'm sure it is based on your experience that you have chosen to do investing in a particular manner. So it's a pleasure to speak with you about Inviga Healthcare Focused Fund that you are setting up. So first thing that I really wish to know from you, Dr. Ajaikumar, is how did you think of getting into investing professionally? I know you are a righteous person. What are your thoughts that create a fund that as a fundamental basis for doing this? I'm sure there must have been something in your mind.
I think you're right. The fundamental basis was how to protect and nurture the entrepreneur, the founder. And particularly, they have a vision. How do we nurture that vision? How do we make sure this vision grows? And what are the possible mistakes I have done? And based on that, what is my learning curve to maybe use that and advise these healthcare professionals on those areas so that they don't have to go through the same process, reinvent the wheel, and they can become successful. For me, most important thing is to make sure that their vision is met, their success. And I am trying to choose entrepreneurs who have a passion for it. Not really serial entrepreneurs, more social entrepreneurs who would like to do something, stay on, not just wondering, about what is the monetary benefit. Monetary can always follow, but the passion with which you start your vision is what I am looking at to see whether we could fulfill their vision.
Awesome. And how big is the fund, and what will be the fundamentals of investment? Will it, you said it has to be a focus, the passion with which the founder or the entrepreneur is focused on, and how will it also ensure that it also bring in the return on investment? Because at the end of the day, the Excel sheets and the revenues that we work on have to fall in place to create a sustainable effort.
No, you're absolutely right. I feel if we choose the right partner and handhold them at the right time, the return will come. The big question is, as you know, some of the people expectation is having a return of high 20s, 30s. I don't think in healthcare it is realistic. You may hit it, but I think I look at somewhere in the teens, 15, 18, 20% return. And I think this is achievable. And of course, not all your investments will succeed. But what I really feel and I look at is while investment return is important, the thematic, being in healthcare and being thematic, what is the impact factor is this? I want to look at that. Our fund is total fund size at this point is about $20 million. We can scale up to $50 million on this. And normally our investment initially for each investment will be below 40 crores. So, okay. And our idea is go into that area where we can help to people come across the finish line. Sometimes, you are close, but you are not there. As they say in English, close, but no cigar. You are there, but you are not there. How do we help them to reach that goal post? So that is where I think both in operation, both in funding, and identify people, look at their ethos, look at their ethics, transparency, and do. For example, maybe can I talk about the first investment, or you want?
I will ask you separately on that, sir.
Okay.
But what I really want to focus on and try and understand is, because You have a lot of experience, and we see a lot of investment happening in the field of healthcare already. There are hospitals that have raised revenues, or investment from VCs and PE also now. Now, is there a compatibility issue with the investors? Because there are hospitals which have been run and managed by leaders who have been doctors themselves, and then there are hospitals which are now being managed by investors. Is there a marriage of inconvenience that happens on the hindsight?
No, I think actually it is a marriage of convenience. It happens very well. Because, honestly, Ravinder, without private equity, we all wouldn't be here. The private equity was the catalyst for us to reach this level. And particularly coming from middle class families, trying have a vision and a dream and try to fulfill is not easy to reach these levels. But for the trust private equity has shown with us. See that trust, and I'm very proud that I was able to, in oncology, able to fulfill and give them the returns to their expectations. So one hand, the private equity, I've learned a lot, the importance of it. On the other hand, I've also learned what does the needs of the entrepreneur, the promoter, what is his vision? Because sometimes what happens, both of them don't work in synergy. At a certain point when private equity come, they have their own vision of exit, what the time exit, how many times they want, and they try to bring in efficiency. Sometimes the whole vision is maybe gets distorted. So my goal is in the fund, I want to use my fund, is to make sure that doesn't get violated. What does if the entrepreneur want? Why did he do it? Is he really a social impact? Let me help in that. But I have no doubt with this model, the return will be there. I think people thought in oncology, nobody will get return. I don't know, in 2000, nobody gave anything, any high fly for the oncology. But today, oncology is like previous cardiology. Everybody is into it. So I feel there is an opportunity as well as a need for us to drive this. So I think we can position ourselves in that spot where we can make a difference.
And Dr. Ajaikumar, there are a lot of these early stage investments that are happening in the health tech space. Now, these are usually engineers who are building efficiencies, but they don't involve the doctor or who's the actual user at an early stage, but they involve them only at the time of testing or when they need approvals. How can this fund, which is led by someone like you who's a medical professional, help early stage investment ecosystem by bringing strategic inputs apart from the money?
Oh, it's a good question, because I am really looking at supporting doctors or true healthcare professionals. I believe sometimes I make a statement, bold statement, non-healthcare professionals getting into healthcare for wrong reasons is not the right thing. Okay. And some of these people who got into healthcare, who have nothing to do with healthcare, I think it is not the right thing, primarily because they say that is where the future revenue is, or the business growth is. But into what is healthcare. Take, for example, when we look at AI, with digital health, all of it are important complements to us. But are they the drivers? No, they will never be the drivers. Like, for example, in oncology or cardiology, are they going to tell us what should be the treatment? That was the hope in the past, but I don't think it will happen, because it is very dynamic. If you treat a disease like cancer, it's an enigma. You can't say AI has generated this algorithm, so let me put it and treat. That won't work. The protocols won't work, because it is ever changing and dynamic. So humans' involvement will be there, who will be the driver. But we can use technology to complement us, to kind of leapfrog to a different level. I think that is where what I feel is I will focus on mainly doctor healthcare services, but I will this fund will not go into any healthcare tech unless doctors are themselves involved in it to some extent from the beginning.
And Dr. Ajaikumar, India has been very slow in adopting research, and it's an expensive bet for everyone, and which is why most companies are not investing in research in India. You have made your first investment with your fund in WinMax, showing confidence in Professor Raghavan Vardarajan and Dr. Gautam Nadik. What are you trying to help solve? And is there a role beyond money that you bring to them? How did you choose them? And what is your intention behind investing in them? So your thoughts on this?
Yeah, certainly. I was, as you know, SCG has been in the forefront of research. Finally, we have got some funding in research from our own HCG for cancer research. So when I see the struggle I am going through, and when I see a couple of scientists of high repute who are going through this process, who have been initially funded, but they are at the finish line. They have to, because they are doing some human trials, they were about to, so they needed this bridge fund to see that they can reach that point. I thought it's certainly something we should participate, and I hope it is successful. We are confident, but even if it is not, I think it is definitely the right thing to do at the right time. And if we don't support Indian research, because researchers we have brilliant minds, as I said, and we can do phenomenal research, but support has to come. And I say, like we talk about walk the talk, we talk a lot, but we have to walk. And that is what I thought I will show. We will walk and show, hey, we will invest and hopefully it will come out good. But our preliminary analysis says it will work out. But jury, obviously the jury is still out and we will know in the next year or two where we are. But I certainly want to support these scientists who have worked very hard for it and show that research can be funded. If successful, it will be a trendsetter for others, like what we did in oncology. People thought oncology will not succeed, it succeeded. So hopefully we will also set the trend here.
Anything else you would want to share about this particular project, sir?
Yeah, I think, we are always talk about, a foreign drug coming from abroad. Drug research in India is not there. New drugs are not happening. And I feel very, very let down because Indian pharma companies are not in big research, even though some are trying to do now. But we are mainly copycats. We copy the drug and say, okay, and we have become very big with that. But we have to spend money. We have to spend money. And this is the time has come. And India also has a lot of traditional, medicines. And why not we take that and see what is the active ingredient, what we can do. So enormous work and research can be done. Some people are trying to do, but it needs support. Not just the government support, but I think private enterprise should support. And I am for that. I know there is enormous wealth. As you know, India is one of the big wealth gap, and we have phenomenal people with enormous wealth. I think they have to come out and say, let us share in this kind of research, come up with ideas, we transform the country. So mine is a very, very small contribution, but I want to see how it goes, and hopefully it will become bigger and bigger as we move forward.
Yeah. And also, Dr. Ajaikumar, one of the challenges that we face in the country, and we have spoken about it earlier as well, is the access. So is there some focus of the fund to invest in projects which are going to solve this problem of access and bring healthcare to the hinterland of our country?
Absolutely. This is I can say is the main focus, because we want to go into tier 2, tier 3 cities, and to the, like HCG has gone to Ranchi, or HCG has gone to Angol, brought in linear accelerators. We transformed cancer care. And today, we are the only one of the ones who are in even smaller cities. Like that, I want to help small doctors in smaller cities who are struggling, who have difficulty competing with the corporate hospitals, like, with technology and knowledge transfer. So I want to see whether we can bring that so that people don't have to travel long distance. Even close by, they can have good hospitals with good outcomes. And one of the areas when we get into these hospitals is to see whether we could measure the outcome. Like today I do, recurrent cases audit, mortality audit. Can we do these kind of audits using technology? So we can show that, hey, if you go to this X hospital, your outcome is as good as going to best hospital in the world. And it is achievable and it can be done. I think that is where we can use data, we can collect data and publish it and really make it something which will appeal to the general public, saying that, because nowadays what has happened is they feel they have to go to the big corporate only. They feel about the outcome may be different. I won't, but the reality may be different. So we have to show them the reality with data. And that is what I would like to work on and show that, hey, this is possible at much less cost and accessibility. Both can be.
Great. What is your plan of exit? Every fund that gets created has a very clear vision of, when will they exit into their from their investments. When will they say that, okay, this is enough, I'm not going to fund anymore in this particular project, or I'm going to exit? So what is the thought behind that?
I think our exit, like any other, we will have a timeline. We are not very short-sighted, maybe 5 years, 7 years, but even longer needed. Because it is just principally mine and Ajay, we are not pressurized by limited partners as of now. Mm-hmm. But when we start getting LPs, next year or two, of course, there will be pressure. So we will deal at that time. But my take is that we should be patient. Because if you are very short term, you are always trying to hamstring the people from really looking at the long-term vision. We straitjacket them. I don't want that to happen. I want to give them the freedom. But at the same time, they should understand the value of money. And which I learned, through the investments. And I'm very happy that through private equity, I learned a lot about fiscal responsibility, curating. I always valued the money of the investor more than my own money. And I showed it. So similarly, I would like whoever is going to be our partner, promoter, investor to look at those kind of ethos and work with us. But exit has to happen. And and I think once this, whatever we put in grows to a certain level, there will be interest from a private equity, because they look at what is the capital required. For a lot of them, it has to be mid-size or high capital. Once you reach that level, there'll be interest. And of course, always there is public at a certain point if it comes to that. So we will see, publicly listed company.
And Dr. Ajaikumar, my last question to you before I let you go is that when you are investing in a project, there is one, the idea, and second is the person who's going to execute the idea. What will be your primary focus? What happens when you come across a great idea, but it is not being led by somebody who's qualified to do that best? What would you do in that situation?
I think the important thing is I learned as being a promoter, CEO, now, executive chairman. Absolutely right. I think the type of people you surround yourself with, type of people you ask them to run and execute are very important as the vision of the promoter. So when we do this investing, it is very important to mutually understand who is going to be driving it. How are we going to monitor this? Like we have a strategic committee, we have to have a committee to monitor. Are they meeting our goals? Because what happens honestly in India is a lot of excuses come. Why did you not meet the goal? Oh, holidays. Everybody knows there is holidays when you do the budget. How are you not? I know these are all normal things which come. So I am well versed into that. So we will make sure that operational excellence is there, and also excellence in margin, how important it is. Margin is not just charging the people more. It is bringing efficiency in the system. How do you buy your drugs, consumables, whatever it is? How are you doing it? How are you putting it to use? So all of this, because of my vast experience and learning from my mistakes, I think I can make sure, but certainly a professionally managed entity is very important, but it should work in synergy with the promoter.
Got it. Dr. Ajaikumar, I think, this is a very fine step by a seasoned doctor and an entrepreneur to get into this, field of investing, especially in healthcare, where you have the excellence yourself and understanding of doing business in India. So wish you all the best. I think, as I always do in the end of every conversation, my takeaways from listening to you is that, one, you're focusing on social entrepreneurs and not serial entrepreneurs, where the focus is on somebody who's passionate about what they are doing and is qualified to do that. So it has to be somebody who's from a field of medicine or healthcare who's driving the project. And you're absolutely clear that, not everything will succeed. You are prepared for that, but at least you don't want the projects to die down because of lack of funds. Correct. So that's a very beautiful thing. And, I took fancy to this when you said that, the vision of the entrepreneur must not be violated while doing this business. So, that's a very beautiful essence with which, you, I'm sure, will drive the investment in India. I wish you all the best, and thank you so much for speaking to us at BW Healthcare World.
Thank you very much. Thanks for having me. It was a pleasure talking to you once again.